I'm here with David. How's it going today?
Hi, good, thanks. I'm the CEO and co-founder of Terra Bioforge.
Terra Bioforge. Tell me a little bit about your company.
We are an advanced strain engineering company that makes drugs faster, cheaper, and better. We engineer bugs to make more drugs. And we have an advanced synthetic biology platform that we use to go after the genes encoding billion-dollar drugs. And most people don't realize it. Unlike simple things like insulin, one gene, one protein, small molecule drugs like penicillin, ampicillin, vancomycin, cyclosporine, you name it. It takes a village of genes and proteins to make those small molecule bioactive compounds. And conventional approaches for trying to do strain improvements where you attack one gene at a time don't really work very well. They're very slow. They take a long time. We've pioneered a whole pathway approach for capturing it and then dumping in multiple copies of that pathway into a microbe, whether it's a bacteria or a fungi, and that results in instant up compound production as opposed to just tweaking one promoter at a time and hoping for the best. So we've pioneered this synthetic biology of natural products with these tools that can capture gigantic stretches of DNA, 150,000 base pairs, and drop in many copies into a genome, but we can still do the precision engineering of promoter changes and things like that. But what is unique and differentiating about us is we have tools for capturing, manipulating, and turning on these big DNA pathways that encode billion-dollar drugs.
You're essentially harnessing microbes or bacteria to analyze pathways that have to do with specific drugs, indications, or treatments.
Because of next generation sequencing, we can sequence an entire human genome as well as any microbe. What's astonishing when you start doing that is how large these genetically encoded pathways are that are required to make even simple things like penicillin. Penicillin is only three amino acids, but it's 57,000 base pairs and seven or eight genes, if I remember right. So it's not simple at all. Even just capturing that pathway, because it's so long and large, is not trivial. You pipette DNA and it shears really easily. So what we've done is pioneer tools for capturing these big chunks of DNA and moving them around and making many copies of it and making precision nucleotide changes. Even in a 150 kb pathway, you still have to make surgical changes one base at a time. Our scale is from a few bases to 100,000 plus bases, and that combination of tools allows us to improve pathways far faster than any other approach. So a good example, that one of the very first natural products ever developed was penicillin. Way back in the 40s, when they started to try to improve it, the existing penicillium strains would only make like 3 micrograms per liter. And after decades of UV mutagenesis and chemical mutagenesis, existing strains now make 30 grams per liter. And because we can sequence the genome and pull out that pathway, we can do the same thing in months instead of years or decades.
As far as the synthetic biology, are you doing that in-house? Are you outsourcing that through strategic partners?
We do all the synthetic biology engineering here in-house. And everybody knows synthetic biology is just a fancy word for genetic engineering. At the heart of everything, we've got new tools that allow us to capture and manipulate really long stretches of DNA, encoding many genes and proteins in a holistic fashion as opposed to a one-off, one change at a time fashion.
Tell me a little bit about yourself. What's your background? How did you get into this field? And specifically, how did you start this company?
That's a great question. I actually got my degree in physiology, which I haven't used since I got my PhD. But I was in one of the very first molecular biology labs. We were doing molecular biology of parathyroid hormone. And I just gravitated toward tool building. And so most of my career has been in the industry developing tools. And you may have heard of this tool called TA cloning. I'm the inventor of that technology that went on to make almost $1 billion in sales for a little company called Thermo Fisher. When that was starting to take off, I thought that maybe this tool building career thing was something I could start a company on. I founded Lucigen. It's a molecular biology company that we built up over the years, and we sold it 8 years ago for 70 million. And so I used some of those proceeds to jumpstart Terra Bioforge. And when I started it, I knew there weren't any good tools for big DNA. And so we went down that path. It took us almost a year and a half to be able to just capture a big pathway and readily manipulate it. Things have accelerated since then. We've got not only the tools for capturing it, but for making multiple copies and for making precision single base changes much faster and easier and more robustly.
You're speaking my language. Walk me through that process of selling your technology to Thermo Fisher. How did that feel when you first were approached by them or when you first approached them? How did you go about that?
Well, so the TA cloning idea was developed while I was still a postdoc at the University of Wisconsin-Madison. And there weren't any federal funds that had come into the lab where I was at that time. So we transferred the rights to ourselves and we sold it to a little startup company that we had. And then we found somebody to take it over. It was actually Invitrogen at the time. So we sold it to Invitrogen, and we didn't think it was going to be a big deal at the time, did not have a good crystal ball, but they ran with it and developed it into this juggernaut. Vitrogen actually kind of merged with Life Technologies, which then eventually got bought up by Thermo Fisher. So it was an organic process that happened over 4 or 5 years. And when we sold it to Invitrogen, it was a straight off, simple deal for us as individuals, but it turned out to be a much bigger commercial product than we had envisioned.
Speaking of standing on the shoulders of giants and taking the work that you did in the lab and having Invitrogen run with it, similarly, who were your mentors and inspirations when you were going through this process of developing your career and getting to where you are now?
I am not sure I would say I had mentors other than my grad student advisor who encouraged me to go and work on things that I like to do, which was tool building. As a matter of fact, as a grad student, I invented a single-stranded DNA vector for rapidly engineering proteins and genes and sold those plasmids as a grad student to some of the biotech companies that were around at the time. So I would say it was Byron Kemper was my best mentor. He encouraged me to follow the things that I was passionate about and good at. I didn't really do a formal postdoc, if you will. I went straight into industry and then took a side turn at the University of Wisconsin for a few years. It wasn't really a postdoc, it was a research associate scientist position. But basically, I gravitated toward tool building people and companies. That's when I got addicted to this, trying to develop these genetic engineering parts that would help move things faster or develop molecules and proteins and pathways better, faster, and cheaper.
I'm a big fan of the non-traditional path, so I can appreciate that you don't have the formal postdoc. One thing that stood out about your story that you just told, you had that entrepreneurial spirit early on. You were already selling plasmids, finding a way to monetize your research. Has that always been the case, or is that something that you ran into at that point?
That was always the case from the beginning. As a matter of fact, when I decided I'd go straight into industry, I did interview for a few postdoc positions and decided I'm really a tool builder, not a basic discovery scientist. And a lot of my peers said, oh, big mistake, you'll regret it. And I disagree. You can have a good career, whether it's biomedical science in academia or in industry. It just depends on where you feel you have a better fit and feel for your career progress.
A little personal question here. If you could sit down with one scientist, one researcher, one entrepreneur and have dinner tomorrow, who would that be?
George Church, he
I
is.
knew you were going to say that.
I've actually had a couple meetings with him, not dinner. Really bright fellow, very easy to talk to, no big chip on his shoulder, just wonderful person to exchange ideas and brainstorm with.
Back to your company, you mentioned some differentiating factors, and I know that you mentioned looking at a host of pathways, not just a single gene mutation or a single gene itself. What other differentiating factors are there about your company? Why would investors look to your company as opposed to others?
Great question. So, for whatever reason, natural products are a very large industry. believe it or not, almost $700 billion of what I call natural product compounds are being developed and sold worldwide. Pharma, almost half the drugs on the market started with a natural product, small molecule compound. Animal health and human products, there's just oodles of things that bacteria and fungi make for us. The problem is that these microbes did not evolve to make much of anything. They're hard to domesticate. If you're trying to overproduce a single gene, a single protein, 40, 50 years of that has made a huge progress for things like insulin and antibody production. And the problem is with natural products, these are bioactive compounds. You're used to thinking of them being called drugs like ampicillin, penicillin, cyclosporine. They're much more complicated. These are not traditional translation protein events. They're biomolecular machines that some of these pathways encode 1 million Dalton proteins. They're huge engines that make these complicated peptides and ketides that form these really potent bioactive compounds. And the tools for manipulating many genes and proteins in a pathway are still in their infancy. We've made a start at some of these improvements, but we've still got a long ways to go. The nice thing is that with next-gen sequencing, we can look at a genome and go, oh, there's 40 pathways in there. We still don't know what the pathway makes, but we can look at the metabolites coming out of a microbe and go, oh yeah, here's these metabolites. So correlating metabolites with their pathway is still very non-trivial. It takes a lot of work, but with the right tools, you can get the metabolite, the compound, and its pathway joined together much faster. And that's one of the things we excel at. A lot of our academic customers use us to clone a pathway that they suspect makes a compound, and they've been right every time. That's really important. But now you've got this compound and it's still toxic, or there's not enough of it. What are you going to do about that? And that's where this synthetic biology can come into play to help you modify the backbone to make it less toxic, or to goose up the production through multiple copies or engineered promoters, or just even changes to the protein itself if there's a bottleneck there. What I like to think of is when Genentech first made commercial amounts of bacterial produced insulin, it radically changed the paradigm of purity, because the peptide was originally purified from pigs, which, there's all kinds of contaminants in there that are not good for you. So radically improved the purity and the quantity and the price. And we're at the same inflection point now with these tools for bioactive small molecule compounds. We can see the pathways, we can capture them, we can modify them, turn them on, make more copies. And I think we're going to see a revolution in the ability to make designer drugs and make lots of it more affordably and things like that.
What does the next 1 to 5 years look like for your company? How do you see it growing and expanding?
Well, we've had pretty good luck with onboarding ag chemical kinds of companies and there's this is not generally recognized, but there's lots of microbes with really potent bioactivities, but there's so little that made it's stuck in a freezer in the valley of death. There's not even enough to cross over and make a bench amounts of it to figure out the structure or even its toxicity and things like that. So we've had really good luck with ag chemical companies where we can take their pathway and make more of it. And sometimes they want to modify it a little bit. We're just now starting to get into the pharma space of pharma companies. And the little biotechs are easier to work with, as you can imagine. They're more agile, they get it. The big biotechs they don't really do, the big pharma doesn't really do the research anymore. They just basically do acquisitions and production mostly. We're still trying to figure out how to integrate our capabilities with some of those companies, and we're just starting to have some traction there. But it's a lot more complicated. The regulatory issues are a lot harder and more serious consequences than coming up with a animal health compound or even a plant health compound. Our goal is to try to become a partner for pharma, but our biggest thing that we're working on right now is developing our own assets. We've engineered over 150 pathways, doing work for others as a contract research organization that keeps the lights on. It's not as big of a upside for us and our shareholders. So we're starting to go into chasing after some of the hardest, worst things around to make it better, faster, cheaper. And one of those is called cyclosporine. Cyclosporine is an immune suppression drug that transplant patients have to take one of two or three compounds. Cyclosporine is the first and oldest one that's out there. And once you've had a transplant, you're on it for life. And you're tied to that supply and its quality and its price. Well, it turns out cyclosporine is made by a fungi, Polyplacladium is the genus name. It's 14 days fermentation. It's not genetically tractable, so nobody's been able to really engineer the strain very well or easily. So the yields are low. It's a really long fermentation. And the drug is very expensive to make, 65% margins. And what's also really hard about this drug and its pathway is it's huge. It's almost 100,000 base pairs. It's got the largest synthase on the planet. It's got a megadalton, 1 million Dalton peptide protein. The synthase is the main core, but it's got 13 genes. And it's produced by fungi. It's the worst of the worst. Well, we've been able to capture the pathway, put it into a heterologous host, and turn it on and make more of it. And so we can make in 3 days what normally takes 14 days. So 4 times faster or 4 times the throughput, 4 batches in the same amount of time as one. And what we're looking to do is raise money to help us finish off the engineering so we can make even just doubling the yield will save billions of dollars in the cost of goods, which could be either used as more profit or used to decrease the price of the drug. So we're a strain engineering company. We don't produce the drug, but we can make a lot more drug from a bug with our technologies. And we'd like to raise $5 million to help us finish off the molecular biology engineering of the strain to overproduce cyclosporine. We've got things like proving it's the exact same compound and purity in chiral centers. And then we still have to do the biobanking. It's not cheap, but it's still way more beneficial with this approach than trying to beat up the old strain. We can decrease the cost of goods by $3 billion by the year 2032 and drop the manufacturing cost significantly. And that will be a huge benefit to the dozen plus companies that manufacture cyclosporine.
Any IP or patents that you hold on this technology?
We've got 4 patents and we're applying for 2 more on the cyclosporine story. Our real strength is not so much the tools that we've got some patents on, but really, how do you engineer a strain to overproduce a very expensive, hard to make compound that's very valuable? Our most valuable IP is going to be trade secrets. And believe me, manipulating big DNA is not trivial. As a matter of fact, there's less than a dozen labs on the planet that know how to make back libraries, cloning big DNA, for example. Well, there's only 2 or 3 companies that we are aware of that know how to capture these genetically encoded pathways that I've been talking about. And we're the only one of those 3 that know how to do even more, how to overexpress them, how to do the multiple copy trick for making more compounds. We're in pretty rare company here with our tools and our capabilities.
Last question, any advice that you have for young entrepreneurs, people looking to get into this industry, start their own companies? What advice do you have for them?
Go work at a company first and see how existing biotech is being done on somebody else's projects and dime, and make sure you fully understand what it takes to be successful commercializing a product. Ideas are cheap and easy, and they're just words. Executing them and making them into a reality is not trivial. And then making something that makes money is even more complicated. It takes a team of people. Get experience at another company, surround yourself with really excellent teammates who know what they're doing, and make sure you understand more than just the technology. Make sure you understand the business behind how to convert that idea into a product that somebody wants. So many entrepreneurs, and I'm guilty of this as well, are driven by the technology and the ideas And that's all well and good, but just because you can build it doesn't mean you can sell it or find a customer. So one of the nice things about developing these overproduction assets of existing drugs that are on the market, they're already FDA approved, so they don't have to be reapproved. But we're changing the manufacturing process. We're making it with a new strain. So there is a 1 year, $1 million-ish regulatory FDA approval for manufacturing recertification that we still have to go through. The nice thing is that that's still much shorter and easier than a 20-year, $1 billion plus quest for a new drug. So that's the path we're on.